Good morning and welcome to the webinar on the growing crisis of unsheltered homelessness in Massachusetts, sponsored by the Massachusetts Housing and Shelter Alliance. My name is Joyce Tavon with the Mass Housing and Shelter Alliance, and this is a third in a series of webinars on critical issues confronting individuals experiencing homelessness during the COVID-19 pandemic. I'm pleased to share that more than 300 people have registered for this webinar, expressing the amount of concern there is about this critical issue. So for today's webinar, I will be moderating a discussion with 4 panelists who offer a range of perspectives on this issue. Before I introduce them, though, let me take a moment to frame this discussion and the reason this issue is so important and urgent at this time. From the Cape to Pittsfield, from Leominster to Lynn, from Boston to Brockton, more people than ever are sleeping outside. Encampments are growing. People are living in their cars or finding places in cities and suburbs to stay. Some people are wary of going to shelters, feeling it's safer against COVID to be staying outside. But even if they wanted a bed, especially as it gets colder, at the moment, in much of the state, they're not likely to find one. By current estimates, we are going to be short more than 800 shelter beds going into this winter. Pre-COVID, there were about 3,000 emergency shelter beds for adults across Massachusetts. In winter, roughly another 1,000 beds would get added, or I should say cots and mats, as people were crammed into shelters, or seasonal shelter spaces were added. But with social distancing, that whole shelter system has essentially been cut in half. And even with the additional emergency shelter about to be added with CARES Act funds, we are still short about 800 beds. If we don't act fast, we are about to have a public health crisis like we haven't seen before. Keep in mind that pre-COVID, Massachusetts had one of the lowest unsheltered rates in the country. Based on the annual one-night homeless census count, less than 5% of homeless people in this state were staying outside. It's a beautiful day today where I am near Boston, but what happens when winter comes? Won't people be at risk of dying outside? Or equally tragic, will mass encampments become the new normal in Massachusetts, as they are on the West Coast and in so many parts of this wealthy nation? So that's the crisis. Now, let me introduce you to our panelists so we can get into our discussion. Joining us from Western Mass is Jay Levy, a regional manager for Elliott Community Human Services and the PATH Homeless Outreach Program. Jay has spent more than 30 years working with individuals who experience homelessness, developing Housing First programs and supervising outreach staff. He's also a published author and editor of books on homelessness. Next, from Boston is Mike Andrick, who directs the Pine Street Inn Street Outreach Teams and Match Mental Health Services. Mike brings more than 27 years of working with vulnerable homeless people in Boston and previously in his home state of Maine. Offering a perspective from one of our small cities is State Representative Natalie Higgins, representing the 4th Worcester District. She's a lifelong Leominster resident, first-generation college student, former nonprofit director, and rape crisis counselor. Rep. Higgins is deeply devoted to finding help for some of her most vulnerable Leominster residents. I know because she has my cell phone number, and I've gotten some of those calls when she has someone with nowhere to go who needs help. And finally, offering a particularly interesting perspective is Vernal Coleman, a reporter on the Boston Globe's investigative team. Vernal joined the Globe in 2019 after covering homelessness, mental health, and breaking news for the Seattle Times. He brings a background in in-depth watchdog reporting on Project Homeless for the Seattle Times, as well as reporting on these issues in Boston. So what I'd like to do for this panel is divide it into two sections. First, a discussion about the current state of unsheltered homelessness here in Massachusetts, and then getting into the way forward and our panelists' recommendations and thoughts on next steps and solutions. So Jay and Mike, let me start with both of you, since you're on the front lines, you and your staff. I've shared some numbers. Now, could you fill in the human story behind these statistics? Who are the people you're seeing outside? Where are they staying? What do they say they need? Jay, let's start with you. What are you seeing in Western Mass?
Well, first, let me just say it's an honor to be on the panel through Mahas. I really appreciate the advocacy that you do. And secondly, I want to give thanks to all of the direct care workers that are out there, the folks working in shelters, the people doing street outreach, which I know a great deal about, the nurses from Healthcare for the Homeless. It's really been something. You're the real heroes right now in the midst of this pandemic. And what we've been seeing, even in the past prior to the pandemic, and what the pandemic has done is it's really exposed the inequities that's out there that we're seeing. Because prior, we would have this system of seasonal shelters that would open up and then come to a close in the spring. And all these people would be hitting the streets. And these would be folks, including elders, people with walkers, people in wheelchairs. And we'd be giving them, you know, backpacks and tents. And this was normal. And this was something that the yearly count wouldn't capture because that's done in the wintertime. So we have had this kind of ballooning of homelessness every summer. And the folks we see out there have major concerns, major disabilities. Many are trimorbid with mental illness, issues of addiction, medical concerns, living in cars, living on the streets. And during the pandemic, as many of you know, so many things have been closed. So people just have not had access during the day. And that means they can't go to libraries where they would normally get a respite from the cold or the heat or what have you. They don't have good access to bathroom facilities. So I don't know if most of us could even imagine to be in these people's shoes of what it's like on a day-to-day basis without access to the basic things that you would need. We know people who haven't showered in months, not days, not weeks, months, because they haven't had access to that kind of basic human caring opportunities that you would hope would be there for everyone. The meal programs are giving things to go. So it's very, very hard. Now, Western Mass is quite a vast area, but when we look at what's going on in the 4 counties in Western Mass, the numbers are quite high and there's just not enough shelter beds. As you know, the shelter capacity has been less, and that's because they're making room to make these safe spaces during the COVID pandemic. So that's feeding into this whole issue right now. And the concern is when I look at Western Mass in the 4 counties, again, that's very spread out. If you look at Hampshire County and you go from this corridor of Amherst to Hadley to Northampton, there's at least 12 encampments, multiple campsites of people staying out. If you go into the Berkshires and we look at places like Pittsfield, there's quite an extensive group of people out there, several encampments around there. If we go up to North Adams, we have over 20 people staying out there. So that's in the Berkshires area. If we make our way to Greenfield, we know right now of over 40 people staying outside in Greenfield. And so there's all these plans right now to try to expand shelter, which is good. We're all working on it locally. There's a lot of good work being done in Western Mass. But our fear is that we're going to fall short. And that seems evident right now. In Hampden County, they've begun doing some work with motels that I know we'll talk more about in the second half, and that's been helpful. But even there's no shelter in the Holyoke area. There's a lot of people that won't leave the town or the area that they're used to being in because that's their hometown. That's what they're used to. That's what they know. That's what they've adapted to. And again, there's a lot of trauma. So not everyone can enter a shelter. It's not just because they have the fear of the pandemic. It's also because the shelters are very overstimulating to a lot of people. They don't feel like safe places. And so we need to have some alternative options to get people in during the pandemic.
Thanks, Jay. Mike, how about if we turn to you in the other side of the state in Boston? Kind of what are you seeing?
Sure. Thank you, Joyce. Big thanks to MHSA for hosting this, and also to echo what Jay had said earlier, just a huge thank you for all the work everyone's committing to around the state to support and keep homeless individuals safe. You know, what we're seeing in Boston really at this time is we've definitely seen some statistical increases. You know, if we look back to the month of June and we compare that to, you know, from 2019 to 2020, you know, we saw a 10% increase of street homelessness. In July, we saw a 37% increase. In August, we saw a 40% increase. September, we saw a 35% increase. Overall, over the past 4 or 5 months, we've seen an aggregate number of a 31% increase of folks that are on the streets. And that's a stark difference from what we've seen in the past in the city of Boston. We're definitely seeing more activity in different areas of the city, different pockets. We normally see higher numbers in the summer months, kind of baseline, but this has been different. And, you know, some of the reasons for that, we encounter folks that are on the streets in different areas of the city. And, you know, we hear loud and clear that there are some homeless persons that have concerns about contracting COVID-19 coming into a shelter. You have capacity issues, as, you know, we've talked about kind of in our shelter system in the city. We're seeing, similar to what Jay was saying, tri-morbid presentations outside where folks are struggling with chronic or acute medical issues, psychiatric issues, folks that are struggling with addiction. Certainly the trauma piece is always there. Folks that have a complex trauma presentation that we're seeing. You know, finding bathrooms at baseline can be a challenge for folks that are on the streets. I think it's more of a challenge now. The library variable that, you know, Jay talked about would provide some respite for folks, and folks can't do that now. So it's a multitude of things that we're seeing on the streets that are a bit different at this time. You know, the Pine Street Inn remains committed to housing first thinking and action in our work. The previous year, we had placed 150 people into, you know, permanent supportive housing. And that's a, you know, huge kudos to the work that's done, you know, both at the Pine Street Inn and with many of our stakeholders across the city. And it's an honor to be a part of that. It's an honor to be here today. I think that, you know, I have concerns as we're moving into winter. You know, people do experience cold weather injuries. It could be hypothermia, it can be frostbite. It's not uncommon for us to see people have limbs amputated. It's not uncommon for us, sadly, to see people die. So I know the city is working hard. Our fearless leader, Lydia Downey, none better. You know, at this kind of work, I know folks are putting their heads together at a city level and in trying to think about what would increased shelter capacity look like.
Mike, you mentioned about the 150 people housed. I'm just going to note we're going to come back to that. But if you could also say something about, like, what are people staying in when they're outside in the city? I mean, Jay talked about encampments out in Western Mass. Are we seeing encampments in the city? Can you speak a little to that? And are they spread out? I mean, we certainly hear a lot about Mass Ave, Melnia Cass, where you have both the epidemic of substance use and the pandemic coming together, but is that the only place that you're seeing people outside? Anything further you can say on all of that?
Sure. No, we've seen increases in the downtown crossing area, the north end. We've seen increases at Nubian Square, formerly Dudley Station. We're seeing pockets of encampments at Eggleston Square. Back Bay has remained pretty steady, Copley Square. You know, and there's some places like that we can't always get into. So, you know, we have the Back Bay tunnels, the tunnel system there. There are times the state police will work with us, you know, hand in hand to engage individuals there. We're always going to be trauma informed in our work, you know, as we're engaging some of these locations, and safety is always going to be paramount for our outreach teams. And there are times like, you know, going into the Back Bay tunnels, we want to ensure everyone's safety when we do that. So, I mean, we've seen encampments on the 4th Street Bridge, certainly Ramsey Park in the city, areas between Mass and Washington. We've seen some spikes. And then there's smaller encampments in Dorchester, Roxbury, JP areas. Does that answer the question?
Yeah, it's all over. And the tunnels are a reminder that there are a lot of people who are hidden, pretty hidden too.
Absolutely.
Yeah.
We also have urban homelessness, you know, in the city of Springfield and in Holyoke, and we see people in abandoned buildings and many of the places under bridges and things like that as well.
Yeah, thank you. Representative Higgins, I want to turn to you next. The city of Leominster doesn't even have a homeless shelter, so I suspect some of this is not new to you. What are you seeing in your district?
So I'm so thankful to Joyce and Mahasa for inviting me to be a part of this. And we connected with Mahasa before COVID really began impacting our community with some issues around access to homelessness shelters. The only shelter for North Central Mass is our father's house in Fitchburg. And so obviously there's inherent capacity issues. If there's one shelter to service the entire area of North Central Mass, they're just not going to be able to meet the needs. So Leominster over the last couple of winters has tried to address some of those concerns, especially in the winter months, by opening a warming center through our Office of Emergency Management. And then they were quickly overwhelmed. One night last winter, they had 33 residents seek services one night. They did not have the volunteer capacity to really support that many of our homeless residents. And I don't think many folks in our city's leadership anticipated that there were that many residents in need. We are unbelievably lucky in Leominster to have a social worker through our police department, Janessa McQuaid, who originally was hired to work on the opioid crisis, but has really built a connection and a rapport with our homeless residents, goes out into the community, mostly into the woods. That's where a lot of our homeless residents are staying if they don't have access to a car, right? A car or truck, van. And I'm thankful that our police department has taken the time to build relationships with these residents, to make sure that they know where they are, that they build a relationship and some trust, so that when the weather gets really bad, they can go and reach out to those folks. They know where they are and they can access them and check in on them. We don't see that in every community up in North Central Mass, kind of that responsiveness and understanding of our homeless residents. But we have been working kind of through the start of COVID. We saw some relief, some of the things that Jay and Mike talked about, right? Like the closure of the library, all of the places, the public places that our homeless residents would go for respite. All of those places have closed. So we were lucky to get a MEMA tent with a portable shower and bathroom. So our homeless residents knew that there was one time during the day that they could go and access hot food. These bathroom facilities, but MEMA has shut those down as of October 1st. right? At the time where they need them the most. And it's great that our Father's House has a mobile bathroom, but helping our residents know how to access them, where it's going to be, the fact that it's now mobile and moving throughout North Central Mass, it becomes really hard to make sure you can get to it. So it's great if you are staying in a car and can get there, but we don't have comprehensive public transportation. So if you don't have a vehicle to be able to go and find that mobile shower, you're not going to be able to access it. And that's one of the other things that we've been working with DHCD and trying to explain, that just because there's a shelter in Fitchburg doesn't mean it's necessarily accessible for residents in Leominster or Gardner. A lot of our residents will say, well, we don't want to take from them. We have a car, right? Like, I'm lucky enough to have a car to stay in. I don't want to take a bed from someone who doesn't have at least this level of safety. And that's a really hard thing for me to deal with. I've been in this office for 4 years. I'm the one who gets the texts from my residents asking, like, do you have a safe place to sleep tonight, Natalie? Because I don't. And this is where I am. And that, like, it's hard for me and my staff. Isabel is watching in. I mean, my staffer, more than 50% of her time is spent with housing applications. And honestly, we have less barriers to access to get our residents into supportive housing, permanent supportive housing, than we do getting them into shelter. And that's an incredibly difficult thing, because what do you do in the meantime? It's not that quick that we can get them into permanent supportive housing. What do we do in the weeks and months that it takes to complete all of that paperwork, have a bed open, and be able to get them into that facility?
Wow, I've got to say, though, that image of a mobile bathroom, this one mobile bathroom for all of, like, North Central Worcester is...
It doesn't work.
Yeah.
I mean, it's great. It's better than nothing, right? I'm thankful that it's there.
But it's just not quite enough.
But it's just not, it's not meeting the needs of a region where we have 3 small cities with significant need. And the story that I've told you before is, spent some time in law school looking at homelessness in India and living in India. And that was part of the project that I was on. Like, in India, they have, for every 1% of the population in their cities, they have a shelter bed. Right? In Leominster, that would be 42 shelter beds. That would mean that there's a safe place 24 hours a day, not a nighttime shelter, right? Because that's a whole other issue that we're dealing with, is for so many of our homeless residents we work with, they work, and they work second and third shift. So how do you use a night shelter? A night shelter doesn't provide the safe space for you that you need when your time to sleep is during the day. So how do we, in a state as wealthy as we are, how are we missing the mark and relying on all of these, Mike and Jay, like all of the folks who work in our homeless shelters, on this patchwork of organizations that are doing their best with, like, such limited resources? We need to do better, and we need to make sure that all of these amazing organizations have the resources they need to truly meet the need of our community.
So I want to turn from now small city to hearing from Vernal, who has a perspective of having reported from Seattle, which, like Boston, is a prosperous city, but one with a huge problem of encampments. What's the same and what's different from your perspective regarding unsheltered homelessness and what you've seen in Seattle versus Boston?
I think everything is the same, and to a certain extent, to the same problems, every iteration of homelessness that you see here in Massachusetts, whether it be in a urban center like Boston or in Western Massachusetts, in more rural areas, that exists in state of Washington. It exists in King County in Seattle. It's just amplified. There is more of it. And to a certain extent, the perception of the problem in King County is that it's gotten worse. And I think there's a lot of things that can be true. It has got worse. That's just simply a numbers game. But our perception of it, or at least the perception of it, it's fed by, I think, a lack of, well, the visual representation of homelessness. There are more people on the streets, but those are people who may have been hidden somewhere, may have lived in what the Seattle equivalent of the Back Bay tunnels, In fact, there is a large area in Seattle, downtown Seattle, that up until a couple of years ago was a place where people could stay out of sight. And the city made a big show of actually closing that area after after years of study and what the effects might have been. And those people moved. They moved into the downtown corridor. They moved into areas where they could be seen. And that just amplified people's, or at least amplified the worsening of the problem. You could see the folks living on the streets. And if you go to the Melania Cass corridor, that is exactly what it looks like. That is a visual representation of how the worst that it can be. So in that sense, you see that in Vancouver, you see that in LA, you see it in San Diego, and it looks exactly like it does in the city of Boston. What is maybe the difference between the two areas is in, well, maybe I would say how the governments are responding to the problem. And what I mean there is that Seattle and King County have spent a lot of money and a lot of time, put a lot of sweat equity into responding to homelessness. It's just they're on maybe the timeline is they're further ahead in their response to it, which is not to say that Massachusetts is lacking. It's just that the problem is worse there. So they have to respond to it differently than, say, Massachusetts or, say, the city of Boston has. And they spent the last 5 years in what amounts to, what is a state of emergency. In fact, the former mayor declared a state of emergency about, I'd say, 5 or 6 years ago, and they're still in it. And the question, I think, is for the people in Seattle and King County, with something they're still struggling with, and something that maybe city of Boston, people of Massachusetts may have to struggle with soon, is what is necessary in terms of resolving the homelessness crisis or that state of emergency, or just simply what they can do to manage it.
Right, exactly. I mean, for the moment, we're talking about the current state of it, and what do we do this winter? But of course, behind that, and very soon we need to get at, how do you solve it?
Yeah, there are immediate problems, and one being the looming winter here. How do you deal? And also, all the concurrent issues like a pandemic layered on top of that. How do you deal with that? And in that sense, Seattle and Boston are dealing with the same issue.
Right. In one moment, I want to turn to some of the solutions. Before I do, because this came up a little around, in a way, the partnerships with police, with mental health services, and there were some questions that the people who signed up for this webinar submitted related to that. I know that Rep. Higgins, you talked about in Leominster, they're taking an approach where the police kind of are working more in partnership. Mike, you may be able to speak to that in Boston, because I think that is a concern. There are places across this state where there's more of the attitude of kind of move them on versus those where there's been more of a partnership around engaging with folks. Anything you want to add on that, Mike?
Sure. I believe Boston has a pretty unique approach to the work, and it's certainly a hybrid approach with multiple parties being a part of that. As it relates to law enforcement and work we do with the police, Deputy Superintendent Mike Stratton oversees a team of 6 folks. You have a sergeant, then you have 5 citywide officers that cover the entire city. And they have best clinicians embedded with the police. The 5 officers are all recovery coaches, just incredible folks to work with when we're going into some of the locations where you're seeing really complex presentations.
And I'm just going to jump in. The best clinician, I think, are people trained with mental health.
Yes,
training.
Mental health. I should say mental health clinicians. We try to avoid acronyms. So we've seen some great outcomes when we're continually partnering with Mike Stratton's team, also with Healthcare for the Homeless, Dr. Jim O'Connell, his street team, Department of Mental Health has been a great resource, the city's Addictions Bureau. You know, it's those partnerships that really help us move towards stabilization and housing. We're trying to really focus on a housing pathway, really day one engagement, also thinking about diversion opportunities, right? There are times that we're able to divert people from street homelessness back to family and friends. So I think that's important to take note of that. But, you know, in general terms, we are able to engage some areas of the city hand in hand with Mike Stratton's team, and we've seen some great outcomes there. No questions asked.
And I think that's a really important point you made that we should underscore, is that the engagement is not simply like to engage people so they're not out in the cold, but actually when you can to get them into housing. And I know I've heard some of your remarkable stories of people like literally going from the streets into housing.
Yeah, I mean, you know, in 1996, there was a homeless symposium. And, you know, just to say this really quickly, it's you know, it's the art of outreach, and how do you do that dance, and how do you dance with grace? And, you know, through those partnerships and that work, we're able to see some really good outcomes with some folks that present as really, really complex. So we appreciate and value those partnerships.
Jay,
just add quickly, it's very important in our work with the police in the idea of decriminalizing homelessness. We don't want people arrested. We want people to be helped. And if we work closely with the Holyoke Police Department, Springfield Police Department, Northampton, Amherst, and we've gotten very good responses along those lines. We know that people of color, unfortunately, end up more in terms of this kind of criminalization that can go on. And we want to try to fix those issues, obviously. So it's really trying to change the culture of policing. And we don't go out so much jointly with the police, although crisis teams do go out with them. We try to keep a certain separation where we're not connected to authority in the work that we do, in the outreach that we do in working with folks. But at the same time, the police will let us know about kind of who's out there, who they're trying to work with. And they've seen through Housing First and coordinated entry some success. Like in Holyoke, we've housed dozens of people now over the last 2 years that were literally on the streets, many police calls around those folks, many crises playing out on the streets. And the police have seen that those folks have actually end up housed and that they don't need to be going to jail. There's another and better solution through Housing First and the wraparound support service that we can do.
And by the way, I suspect that most people watching this are kind of deep in this work, but in case they're not, just so folks are aware, when we talk about Housing First, it is literally that what needs to come first is housing, getting someone in a stable situation, a roof over their head, and then from there, with a wraparound of supports, you can address the other issues, whatever they may be, whether it's struggling with addictions or illness, whatever, as people feel like it's their choice and they're ready. So, right. Thank you. As I mentioned, we received a lot of questions from people who registered for this webinar. And one question that many people asked in a kind of a number of different ways basically came down to, like, what is the state's plan for this coming winter? And some asked, you know, in coordinations with cities and towns, but some noted, you know, people move around, some are being pushed out of particular areas, and that ultimately people were asking, well, we need the state engaged and involved. And I did mention in the opening that plans are underway to add a significant number of additional shelter spaces, and staff at our Department of Housing and Community Development, I know, have been working extremely hard on all of this. And yet, as I mentioned, we're still projecting this huge shortfall of beds. So I know that all of you are not, the state policymakers, but interested in hearing your insights. Rep Higgins, especially given, you have the perspective as a state legislator, any thoughts that you have that any other things the state might be doing this winter in the immediate?
I'm still waiting to understand what the policy and the plan is going to be. I mean, DHCD has heard from me daily, and my office daily with a number of cases that we're concerned about. And right, like this isn't happening in a vacuum. The governor decided to end the eviction moratorium on Saturday. And a lot of the protections and policies that are in place aren't actually ramped up yet. And that's one of my major concerns. And we know for so many of the folks that we work with who do have housing and get an eviction notice, right? Like just the threat of an eviction is enough for someone to leave their home, right? Not everyone understands their rights, and that they have to go through a court process, right? Like, and actually be evicted. And so that adds so much more complication to what we're dealing with. And one of the other things that we struggle, because we don't have a homeless shelter in Leominster, right? We're not necessarily included in those conversations when those new funds and those new resources are rolled out. It was a lot of trying to catch up with, thanks to MHSA, to find out what was happening in North Central Mass so that we could get our residents connected to the services that were coming at the beginning of the state of emergency. We need a more comprehensive plan. We need to make sure that everyone kind of understands how these funds and these resources are being rolled out. And we feel like we're constantly chasing down the information so that we can connect our folks to it.
Yeah. I mean, and also, in fairness to the state policymakers, in part, we're struggling with what is a patchwork quilt of shelters across the state. I said there typically were 3,000 plus emergency shelter beds, but there wasn't necessarily a particular pattern to where they are. So you have those big gaps in where there even was existing shelter in the first place, and now add this crisis on top of that. Yeah.
And so we've worked really hard, just Joyce, to add to the housing first. We've worked really hard to connect our homeless residents to permanent supportive housing. And we're really thankful for the work that SMOC does up in our area, because we've had really great success stories once we're able to access an open room, right? Like that's the biggest piece, is making sure that there's an opening and availability there. And they don't operate enough beds in our community. They need more.
Well, I will say that was the second kind of major question that came up over and over from people who registered was kind of, when are we going to bring to scale enough housing and support services to provide that permanent supportive housing for unsheltered homeless people? We've touched on a little. One thing I will add is the use of non-congregate shelter and hotels. That we're seeing more of that right now in terms of what is getting added, and the little bit of a bright spot in that is it actually gets people into some space that gives them a little bit more privacy and dignity, whether it's a hotel room or some kind of other semi-private space. And how can those be the starting point for housing? I don't know if anyone wants to comment on that. Go ahead, Jay.
Yes, I'd love to. So there's been some really great work in the Springfield area along these lines, and it's working in conjunction with coordinated entry. Some monies came through, ESG funds, care funds came through. Catholic Charities was able to overlook opening up motels where we could connect people directly from the outreach teams. So it's very important that the outreach teams have very quick access to the motel rooms, because as you meet somebody, you want to be able to move them quickly. So we set up a process, again, through coordinated entry, through the local COC, working in conjunction with Catholic Charities and all the providers that are meeting people outside to get them in quickly. All we need to do is to have an ID and a letter that certifies that they're homeless. We get them into the motel. Whoever does the placement, in our case, our PATH team, we've placed over 25 people now into these motel beds around Springfield, West Springfield. We then do the wraparound service. We do the follow-up. We connect. We're there going over the by name lists and matching people to housing opportunities that they can go directly from the motel into housing of some sort. Just in this past week, we've placed a few people into Section 8 housing through Mainstream, or actually, Section 8's through Holyoke Housing Authority. There's also permanent supportive housing that we're able to connect people in that way. So the key is really, to the degree that you can connect this all to the coordinated entry system, of course, add more housing opportunities to the coordinated entry system. And in Springfield, they've done a nice way of bringing the providers around the table, where we're going over these by name lists, making these housing matches on a regular basis. And now we go over that motel list. Over 90 people so far in Springfield, West Springfield, Hampden County have been placed into motels. And a lot of these folks wouldn't make it in shelter settings. So that's the other thing to really look at. Shelter setting is not a fit for everybody when you look at the significant level of trauma that a lot of folks have been through. I just want to give a quick shout out to the idea of safe havens too. We need that for people who have severe mental illness, who are out on the streets. They're much smaller settings. They have 24/7 staffing. It's one of the first housing first type programs that were out there. DMH funds them. We'd like to get more funds for that in the future. Very important that we have a safe haven in each county. We have 4 counties in Western Mass right now. We only have one safe haven. It's a great one. It's run by MHA. They do wonderful work, but we need at least 3 more, maybe 4 more safe havens.
And I'm nodding my head in recognition, because I did get to talk to the director of that hotel program in Springfield, who was talking about people who are out on the streets who, you're right, no way would they go into a shelter, going in and feeling much safer in having that room their own. Vernal, I'd like to turn to you. I know your role is to kind of investigate and report, but I know as we were discussing this webinar, you were talking about the issue of housing and the challenge you were seeing in Seattle and seeing here as well. As you listen to this discussion, what are your thoughts on, how are we going to get to the housing solutions?
Well, I'm not sure if smarter minds than mine have not been able to, I think, come up with what is a solution to the problems that Massachusetts face, or the city of Seattle or the city of Boston face. I can say that what Seattle represents, I think, is a lesson. Again, they have been going at this for a very long time. There's been a lot of discussion about how to address this problem. And to be clear, there is an incredible amount of money that is spent on providing people services and housing in Washington and King County. I don't know that anybody who does this work or is any way tangentially related to it would argue or would say that it is enough. The question is, how do you bring that amount of money to scale so that it is adequate to address the problem? And what I think you see, even in this week in King County, in their own response to us, again, this is a problem that has been going on for decades, but the state of emergency has been in place for at least for the better part of a decade at this point. And yet there is a, I don't know if you call it a stagnation, but certainly a lack of consensus in how to actually address this. Just this week, the King County government proposed a tax in order to create more space, motels, more space and more money to convert existing buildings into housing for homeless people. And this was sort of a part of a grand plan to create a central government structure, central governing authority for the countywide response to homelessness. I don't know if it bodes well that several of the cities in King County who were part of this conglomeration of city governments have opted out of that tax. And I don't know that it bodes well in terms of just their cooperation to respond to this problem. So the task that the folks who work on this in Massachusetts, what they face is, I think, is pretty significant. And the daunting part of it, and it's daunting, certainly, but the reality is that, at least in King County, there will be people who are, for lack of resources, are left out on the street. And there will be deaths. It happens every single year. And that is the problem. That is the attendant problem to this, is the reality of it. So I don't know how do you get there in terms of solutions. I think, again, there are various different cities and counties and states that provide, whose experiences are instructive, but I know what the problem how bad the problem can get. And so, yeah, I would just say that the issues that you're facing are significant. And whatever comes of this, well, I hope that it is, I hope that there's a solution on the horizon.
Yeah, so what I'm hearing from you is the problem got bad enough in Seattle and King County to create a state of emergency, to have enough political will to start to look at targeted taxes to create more resources. And yet, even that,
Yes.
Places are opting out of, are not quite there.
Because the needs of some cities aren't necessarily the needs of other cities, because the various different perspectives on how to actually address the problem. Well, there are various perspectives on how to address it, and there's lack of consensus. When you talk about regional partnership here in Massachusetts, I think it's going to, if Seattle is instructive at all, or King County is instructive at all, it's that it takes a while and some doing to get everyone on the same page and bought into a multi-pronged or cohesive strategy. So, if Massachusetts is going to go down the road, or if Boston is going to go down the road with its regional partners, it probably will be an uphill battle, and one that will take years. But again, the option to do nothing, or the option or the failure to do that, to address the problem, means that, well, come winter, you'll be facing the exact problem that the state is facing now, in terms of a lack of resources and people being left out on the street.
I mean, I think it's fair to say that there's a good amount of agreement in this state that permanent supportive housing has been proven to work at ending homelessness for some of the folks who've been out there struggling with all kinds of issues. But we don't have enough of it, right? And that's the issue.
And that problem exists, I think, in a lot of cities and states that are experiencing significant problems with homelessness, or high populations of homelessness. The trick of it is to, how do you actually generate the funding to create to right size permanent supportive housing, or the other supports that you can bring to bear on the problem.
Any comment, Rep. Higgins, you want to make on the building of political will to get us those resources?
I think we're getting there, right? I think it takes more communities like mine who haven't necessarily had those resources speaking up and saying, we need them too. These are our residents and they deserve a safe place to stay in their home. And we got to figure out how to fund it. I mean, we're having this conversation about however many topics about how do we fund this and how do we do this fairly and equitably. But in a state as wealthy as ours, that also experiences winters like ours, I find it really hard to believe that we haven't put more time and energy into figuring out how to fund the successful projects that are working. And I'm happy to learn from all of the folks who are doing it. When we had the organizing call about this, I mean, it was just amazing to hear the work that Jay and Mike are doing, because I want some of those like low barrier access to services that I just haven't been able to find in my community.
If I could mention just that The other thing we need to look at is kind of the influx into homelessness. And it's really a kind of an inflow and an outflow issue in regard to keeping up with the pace of kind of the economic engine and the culture that kind of creates homelessness being a problem to begin with. And one of the things we have that happens quite a bit is institutional discharges into homelessness. That's a big feeder. And I think we really have to take a serious look at that because, while people are in these various places, whether it's in prison, whether it's coming out of the criminal justice system, or whether it's hospital discharges directly to the streets, we're seeing more of that now because the shelters have not been open at capacity, able to take folks in the same way during the pandemic. And this could be a crisis opportunity to take this issue very seriously right now in terms of what should institutions be doing and how can they build and perhaps even save money in terms of, in the end, looking at having people not end up back in jail, not end up back inpatient, and the high costs that ranges, not clogging up the emergency rooms, but by having some, through these big institutions, some monies put aside and put toward, transitional housing programs and things of that nature that will help people to get situated rather than us meeting them on the streets and hearing today or yesterday they were discharged.
Right. I'm really glad you brought that up because that is such a big part of the inflow into people who are on the streets. It seems like it's much less common that you're going to find people on the streets who a month or so ago had a lease and had their own apartment, but rather they're cycling in and out of these other, sadly, fairly broken systems, jails, prisons, mental hospitals, medical hospitals, substance abuse treatment centers, and all that do not have enough in the way of next step resources. So yes, absolutely. And we've been getting a lot of those kind of calls and emails as the shelter system has had less space. People are like, well, where do we send people? So yes, absolutely. Mike, was there something you were about to say on that? Okay.
Yes, I would agree with what Jay was talking about. This may be an opportunity for us to get creative. There could be cost savings there, and could that be used to look at housing? And I think that collectively we have to continue to come together in the city of Boston, in our work together with folks that are on the streets. I mean, we do see miracles happen every single day. We never give up, which is a seeking safety mantra we embrace as a team. We always have to embrace housing first, thinking in action, but there's so many upstream steps that could be happening to address some of the discharges from psychiatric institutions, from DOC. We have a whole triage department that is very active, very nimble, very effective in their work at diverting folks kind of coming into shelter. But there's certainly some upstream work there to do, as Jay eloquently said.
So I'm just mindful of the time, and I know we're going to need to wrap up shortly. Just want to recap, I think, some of the themes that we've brought up and kind of recommendations. I mean, clearly, kind of the housing first approach, getting us to permanent supportive housing, seeing that while right now we're in the midst of this crisis and need more space to get people inside safely, any of those efforts that we've seen of adding motels, hotels, non-congregate shelter have been a really effective way to go. And looking at the inflow from those other systems of care and what those systems can be doing, certainly working in partnership with us to ensure people are not ending up in homelessness. I think those are some of anything else that I've missed there in terms of the kind of key themes. If not, then I do want to take a few moments before we close, first off, to thank all of you. Really appreciate this discussion and your engagement. I'd also like to thank our partners at Rasky Associates who helped produce this webinar series, and my colleagues at MHSA, Caitlin Golden and Joe Finn, who did so much behind the scenes to organize this event. Finally, in closing, I think as we talk about partnership, I mean, that is so key. How do we move forward and address unsheltered homelessness most immediately before this winter comes? And to our partners in state and city government, and to all of you, how do we work together? And let's work together to ensure widespread homeless encampments don't become the legacy of the COVID-19 pandemic in Massachusetts. We've heard about some of the effective interventions going on in some different spots across the state. How do we make that a little bit more consistent and do that with some state planning? And how do we use this crisis kind of as more of an opportunity? Vernal talked about in Seattle and King County kind of raising the visibility and really shining more of a light on what we are seeing, whether it's people, out in encampments, seeing more of it, people out on the streets, and the people who are more hidden in the tunnels and alleys, and taking from all of that and really focusing on permanent supportive housing. We've done it before. We've proven that it works. So let's make sure that all people experiencing homelessness have a decent and dignified place to live. And on that note, thank you all for joining us today. Thank you.